All right, let's get started, and any other people coming in, I will let them in as they come. Um, I'd like to introduce myself. My name is Heather Jenkwin. I'm the coordinator for the Millburn Municipal Alliance Committee. For those of you who may not know what the alliances are, we are organizations in every township throughout the state funded by the Governor's Council on Alcohol and Drug Abuse, and also with funding from the Millburn Township. And our mission is to provide substance abuse prevention, education, and community wellness programming. We do a lot of work in elementary, middle, and high schools with the peer leader programs, different Red Ribbon Week, Family Meal Week, and we try to do a lot of parenting education programs. So we're active in the community, and we're very excited tonight to have Dr. Mahajan join us for this presentation. Very timely as we move towards getting the structure for legalized recreational marijuana use in New Jersey. And, figured now is the time for parents who might have questions, kind of educate yourself on what will be available, what will be out there, and really trying to make sure that the youth understand it, the risks, and so that we can prevent underage use of marijuana. So without further ado, I'd like to introduce Dr. Mahajan. Dr. Sonali Mahajan was born in India. She immigrated to the US at a young age. She grew up in Tennessee and completed her general psychiatry residency and fellowship in child and adolescent psychiatry at Emory University in Atlanta. Since that time, she's worked in different states and held a variety of positions, including those in academics, public mental health, family court, and both for-profit and not-for-profit institutions. She brings a wealth of training and clinical experience to her work. She and her family moved to New Jersey in 2019. We're very lucky to have her here in Millburn. And she works at the Hackensack Meridian Health Systems in the Pediatric Psychiatry Collaborative Program. And she also has a private practice here in Millburn. Her main focus of the practice is to provide high quality evaluations and ongoing care to children and adolescents and their families. During her downtime, she enjoys traveling, spending time outdoors with her family, cooking, and gardening. So we'd like to welcome her, and I will let her begin the program.
All right, thank you, Heather. Let me just share my screen here so we can get this going. All right, so just scoot back. There we go. So I appreciate the opportunity from Heather and MMAC for welcoming me and giving me the chance to talk about this with you all today. As a child psychiatrist, I've had to work with a lot of teens that have substance use problems, so it's not as uncommon as you might think. And I do have to make a disclosure that I'm not board certified in addiction psychiatry, but I'm bringing this talk to you based on my clinical experience, my training, and the recent research that we've done into this area. And I do want to give some thanks to Katie Montgomery. She's here with us tonight. She's a fourth-year medical student at Rowan University, and she's hoping to become a child and adolescent psychiatrist, and she just needs a few more years of training. So I do appreciate Katie's dedication and the number of hours that she's put into helping me with this. We're going to jump right in. And so we'll talk about these sort of topics today. And I won't go through this in detail, but we are just going to go ahead and go into the components of marijuana. So for marijuana, just a moment, let's see if I can move this. There we go. The components of marijuana. So marijuana comes from the cannabis sativa plant or the cannabis indica plant. And these plants have close to 500 psychoactive chemicals. We know that the two components that are most commonly seen nowadays are THC and CBD. Now, the CBD component does not have any psychoactive properties, so it's not mind altering like THC is. And THC is usually the component that's used to gauge the potency of marijuana these days. So when it comes to marijuana, hemp, and CBD, they're all derived from the same plant. You might hear the term hemp in some areas. Hemp is a specific variety of the cannabis sativa plant, and it was historically used to make industrial products like rope and cement and clothing. And it is actually the component of where CBD comes from. So CBD is derived more often from hemp, and CBD has been found to be effective somewhat in anxieties and seizures, but it can cause some liver problems. And actually, the mechanism of action, so the way it works in our body, is really not clearly known at this point. So marijuana is the part of the plant that has more than that 0.3% of THC, whereas hemp and CBD have a much lower content of THC. Now, one thing to note is the DEA, the Drug Enforcement Administration, determines a classification of a drug under 5 different categories or designations, and they call these schedules. So these schedules are based on whether a drug has any medical benefit and if it has any abuse or dependence potential. So when we look at the Schedule 1 drugs, these are the ones that have no medical benefit and have a high possibility of dependence or abuse. And these are such drugs such as heroin or LSD, and actually marijuana is considered a Schedule 1 drug as well. Now, hemp extracts like CBD have actually been taken off of the Schedule 1 designation because of their low THC content. And then certain medical marijuana products have also been taken off of the Schedule 1 designation because they've been found to have some medical benefits. And we'll talk about those in just a bit. We do need to know the forms of marijuana that are available today. And this is, you've probably seen these things in different ways. So the first forms that we'll talk about are joints, blunts, and bongs. These are smoked sorts of things. The top left picture is a picture of a joint at the top, a spliff in the middle, and a blunt is the brown one that's wrapped, it's essentially hand-rolled THC into cigar wrap. And there's also bongs. I don't have a picture of those, but essentially if you can picture sort of a bowl of water and it's got 2 pipes that come out, the side, one out of the side and one out of the top. Essentially the side pipe is where the marijuana product goes into, and it gets lit up and it develops smoke inside of this bowl that's got some water at the bottom of it. And the smoked part is what gets inhaled by the person using this bong. So you'll see at the top right, this is what are an example of a smoked extract. This is called dabbing, and they can have terms like waxes or shatters or dabs that they're called. Now, these are really highly concentrated forms of marijuana or THC, and these contain 70 to 90% THC. So what that gives is a fast onset of the high feeling that people get. Now, the bottom right picture is vaporizing devices, if you will. So we know that these sort of devices usually were liquids and they get inhaled as a vapor. But if we think about these vaping devices, they originally came out for flavored liquids and nicotine, and now they are used for marijuana as well. And if you can see the sizes of them and how they're created, they're much easier to carry around than a blunt might be, or a joint might be, because it might get broken. And these are very easy to hide in backpacks or pockets and things. So something to think about. Then we've got the edibles, which are the pictures in the middle with candies and candy bars and cookies. We know, you've probably heard about marijuana brownies and things. These also have a higher THC content than the smoked versions, meaning the joints or the blunts. And what happens with these is that there's a slower onset of action and they last longer in your system. So some people can get in trouble if they start to eat a candy bar and they have, one small piece and then they don't feel it right away. So then they have another one and maybe another one and then maybe a brownie on top of that, trying to get that high feeling. And what happens is that it hits them a little bit later than they're expecting, and it's too much for their system. So they end up feeling really sick and the effects last in their system for quite a while. So it cannot be a good experience for some people. Now, the bottom left product is the synthetic marijuana. It's called K2 or spice. And essentially, this is a dried plant material, but it has man-made chemicals sprayed onto it. And what happens with these chemicals, they end up making it more powerful and more unpredictable. And what we saw when this first came out was that there were quite a few ER visits for intoxication and rapid heart rate, vomiting, and actually hallucination. So it's a little bit harder on your body, I think. So this slide shows the trends of percent use of these products in 8th graders, 10th graders, and 12th graders. And if we just look at the left graph for now, it's the use of marijuana over a lifetime. And you'll see from 2017 to 2020 in those different grades, not too much of a difference. There is a tiny bit of an increase for 8th graders. It went from about 14% to 15%, for 10th graders 30 to 33%, and 12th graders stayed around the same, or 44, 45%. But when we look at vaping, the top right graph, over a lifetime, you'll see that between 2017 and 2020, each of those bars went up. The blue went up from 4 to 10%, meaning the 8th graders. And then for the 10th graders, it went from 10 to 22%. And for 12th graders, from 12 to 28%. So you'll see that actually has increased quite a bit from 2017. And if we look at the bottom right, we'll see synthetic marijuana, which is just looking at the past year of how many of these 8th graders, 10th, and 12th graders used within the past year. And you'll see that number has actually decreased. All those bars have come down a little bit. And one of the things is, are people getting the word that this is not a good product for them to use, or it makes them feel very sick? Or could it be that the vaping has gone up because that is an easier product to use, and it's easier to hide and potentially easier to get? So not sure about those trends, but it is trending higher in terms of the vaping. This is one of the most important slides. It's about the potency that we need to know about now as compared to 20, 30 years ago. And this comes from an article called Mapping Cannabis Potency in Medical and Recreational Programs in the United States. And what we see now is the marijuana, the THC content is about 12% on average, whereas it used to be about 3 or 4% back in the 90s. And we know that the edibles and the concentrates are much higher in their percent of THC, which is, according to this study, around 62%. We also know that higher potency increases the short and long-term medical problems and the possibility of ER visits. When we have higher potency, we've got larger effects on the brain, and this could lead to dangerous side effects such as nonstop vomiting, hallucinations, increased heart rate, trouble breathing. And if we look back at Colorado and the ER visits that they had that were related to marijuana, those visits were due to severe intoxication, vomiting, psychiatric problems, and severe cardiovascular events. So we know that it affects the body in multiple ways in many areas or systems. There's also the increased risk of psychotic disorders in daily users compared to people that don't use at all. And now the third bullet point there is that the lowered CBD content increases the psychotic effects that are induced by THC. So psychosis means hallucinations or feeling paranoid, feeling like people are watching you or out to get you. And what happens with THC is that it can induce that effect, but CBD might have the properties of sort of counteracting that. But now that we've got lower CBD content in our products, there's not that much of a CBD effect on lowering the psychosis. The other concern about this is there's also no current regulation on the percent of THC for medicinal dosages. So there's no cap, there's no high amount that the FDA says it can't, this is the highest that this product can be. And what we've got now is 33 states plus New Jersey and the District of Columbia are allowing medical marijuana. And cannabis has been shown to have some effects for treating anxiety, pain, spasms, seizure disorders, and nausea and vomiting from chemotherapy. The greatest effects have been seen towards chronic pain, nausea and vomiting due to chemotherapy, and spastic or tight muscles. And the problem is that the FDA actually doesn't oversee medical marijuana like it does other prescription drugs. And it sort of leaves that up to the states to regulate these and monitor these sales, but the states may not have the resources for that. And so what that means is that the potency of these medical marijuana products and the actual other ingredients that are included could really be different from one place to another, depending on which store you buy it from or which manufacturer has that product out. So what we have seen based on research is that the amount of marijuana, the the amount of THC concentration is actually 2 to 3 times higher than what it might need to be in the example of using medical marijuana for pain. So it's potentially higher than what people actually need to get. There are some side effects of medical marijuana that have been reported, such as depression, high heart rates, low blood pressure, hallucinations, bloodshot eyes, and dizziness. And it can also affect judgment and coordination. So there's a risk of potential accidents and injuries related to that. So we're going to talk about short-term effects and longer-term effects. Short-term effects are in the immediate, period after ingesting or inhaling marijuana. And at first we can, have distorted perceptions, which means that the way that someone experiences lights or sounds or touch or time are altered. And typically what people get is that time seems to be slowed down for them. There's also impaired cognition, which means that there could be learning problems, attention problems, or memory problems, as well as poor coordination and motor skills problems, which can be affected. And then psychiatric manifestations means that what we've talked about before is the paranoia or hallucinations and maybe even anxiety that can be experienced during the immediate period. Now, hallucinations and paranoia are believed to be dose related. So the more THC, the more likely or the more strong those effects are going to be. But the problem here is that these may not respond to antipsychotic medications that are usually meant to treat hallucinations and paranoia. So that can be kind of a scary place for someone to be when there's no immediate treatment other than letting this sort of wear out. So there are some other short-term systemic effects, such as the high heart rate and sleep problems and appetite increases that people might experience. And then we've got longer-term effects with repeated use. So there is the risk of addiction to marijuana and potentially other substances. We know that if there's heavy use in youth, meaning teenagers, they might have more longer-term learning and memory problems. And then we've talked about some of the psychiatric problems that can happen. But with longer use, we do have an increased rate and worsening of mood disorders, anxiety disorders, and psychotic disorders. And those that have a family history of schizophrenia they have a 2 to 5 times increase in the rates of schizophrenia themselves if they're using marijuana. So we do want to be careful about this in terms of their overall mental health. And then there's the possibility of chronic systemic effects. Now, marijuana contains some of the same chemicals that are found in tobacco, and there's been some concern, that smoking marijuana could harm the lungs, but the effects of that aren't as clear just yet. There is some evidence that it might increase the risk of chronic bronchitis or cough and other lung problems. And then we know there's carcinogens and toxins in marijuana, and that this could lead to an increased risk of cancer for some people. And then there's the risk of recurrent severe nausea and vomiting that's been associated with marijuana use. We'll also look at this slide here, and this one's important for our teenagers especially, and our young adults, because in this we talk about brain development and what areas of the brain are still in development over time. So brain development continues from the time of conception until around age 25 for these areas to get to their mature states. So they're still developing. So during this period of neurodevelopment, the brain is particularly sensitive to any insults, especially any damage from drug exposure. We can talk about the frontal cortex or the frontal lobe, that's this part right here with where our forehead is. And if we look at early onset smokers, those are the people who started smoking before 16. They actually were studied, and they started to make twice as many mistakes on tests of executive functioning, which are related to planning abilities, flexibility, and then abstract thinking. And if we look at white matter changes, these are the areas in our brain that are all over, and they help with communication of neurons. And essentially, again, people who smoked before age 16, this area was affected, and it's correlated with higher impulsivity in these young people. And then we've got the amygdala as well, so memories and emotions and things. So with this, longer term use was found to have decreased volume of the amygdala. So this brain structure is actually smaller for people who have more longer term use. And again, so we're looking at potential impacts on memory and decision making and self-control and emotions. So if we think about the previous slide and consider how those areas might get impacted, we know that there's probably going to be some academic effects or academic problems. And people who use marijuana as teenagers, they have a decreased IQ by 8 points on average, and that's significant. And this is not reversible. And that's the point that I would, want you to focus on is this is actually very similar to what we get from lead exposure or lead poisoning, where lead poisoning actually damages the brain and nervous system. And in those kids, you have slowed growth and development, speech problems, hearing problems, learning and behavior problems, a lowered IQ as well, and then trouble paying attention and not doing so well in school. And you'll see that kids who are smoking marijuana do have trouble with their academic performance and increased dropouts. So something for us to definitely keep in mind. And if you all will look at this set of adverse social effects, I won't go through each of these, but I do want to point out a couple of them. And one would be the increase in risky sexual behaviors. This is especially concerning because we've got teenagers who may not be protecting themselves as well and may not have access to those things that they need to. And during this time when they're high, they might be feeling euphoric and excited and sort of disinhibited and not real worried about the consequences that could come. The other thing is that there's driving accidents and fatalities that are associated with the driver under the influence of marijuana. And this is because of the areas that get affected with their coordination problems and reaction time problems, and then the perceptual changes, right? So they may not be hearing or seeing the things that we would be hearing when we're not under the influence. So these are very serious concerns. And next, we're going to go into sort of the warning signs of things we might see if someone is using marijuana. And we've got some short-term warning signs and then some longer-term warning signs. So these are the short-term warning signs. So you might see that they're, if the person is intoxicated or under the influence at that point, they might have some memory problems in the moment. They might be uncoordinated or giggly. They might have bloodshot eyes. You might see that they're opening their windows, using some deodorizer or incense to try to get rid of that particular smell that's on their clothes and in their room if they're using in their room. And they might have money laying around and you're not sure where it came from, or the jewelry or the clothing that makes them, makes it look like they might be using. You might also find some actual marijuana, in their room. And, that's something that we want to pay attention to. So there is such a thing as cannabis intoxication, which is essentially someone who's high and feeling the effects of marijuana. And for that definition, they must have had recent use of marijuana with a significant problematic behavioral or psychological change happening, meaning they've got impaired coordination, they're euphoric or elated, giggly. They might be anxious, they might feel that time is slowed, or they have impaired judgment. And they must have two or more of the following: that bloodshot eyes, the increased appetite that we see, the dry mouth, or the elevated heart rate. And of course, they might also be hallucinating, although that's not a required thing for being intoxicated. Now, these are the longer term warning signs, and you can just see that this can affect people in many different areas of their life: social relationships, potentially jobs, might be getting in trouble at school, trouble with, skipping school and just losing interest, not wanting to do the things they used to do. So what's important to note is that a lot of these signs are also signs of depression or anxiety. So we don't want to assume that someone who has these signs is actually using substances. What these signs need to tell us is that there's probably someone in need of professional help at this point to help us clarify what might be going on with this person. So again, we don't want to jump to conclusions that this is all related to substance use, but it certainly could be something else. And on this slide, I want us to focus on the points on the left of the slide. So this is about marijuana addiction in youth. We know that the earlier they use, they have the greater risk of developing an addiction. So if someone uses before 18 years old, those teens are 4 to 7 times more likely to develop a marijuana use disorder compared to an adult who might use. And 1 out of 6 teens who use will develop a marijuana use disorder. And youth who use marijuana are at greater risk of developing addictions to other substances. And we all have heard about the opioid epidemic. Those are just some statistics to tell you how serious that epidemic has been. And if we think about what addiction or marijuana addiction is in medical terms, we call this a cannabis use disorder. And this is essentially a problematic pattern of their behavior that leads to significant impairment or distress. And it requires two of some of the following. I'm not going to list out all of the possible criteria, but what we might see is that someone is using for a longer period of time than they intended to, or they're using larger amounts that they intended to. Now, they might be building up tolerance, meaning they need a larger amount each time they use to feel that same effect that they got the first or second time around. They might also be experiencing withdrawal symptoms when they can't get it regularly like they had been getting it. Um, these people also might be spending more time trying to gather it, trying to use it, and trying to recover from it. They might not be meeting their social responsibilities, such as work and school responsibilities, or they might be dropping out of things that they used to be interested in. And they might be using despite consequences, right? So they got in trouble at school, or they got grounded, or they lost a best friend because of this use, but they continue to use despite those consequences. There are also other disorders that are related to marijuana use, and these can be such things like cannabis-induced psychotic disorder, cannabis-induced anxiety disorder, and there's a cannabis-induced sleep disorder. So we know that cannabis is relevant to some of these other things that have been identified, and we do want to look out for those sorts of things as well. So there is such a thing called cannabis withdrawal, and it requires a pattern of heavy use, or which is daily or almost daily use over a period of several months. And it requires 3 or more of these following experiences or symptoms. And they have to occur within a week of stopping that regular use. So you can read some of those. I'll just note that under the physical discomforts, they are usually restless, and then they might have stomach aches, shaking, tremors, headaches, fevers, chills, and sweating is some of the physical discomfort that they might feel. And this is a mild withdrawal. It's not as serious or life-threatening like alcohol withdrawal or benzodiazepine withdrawal might be, and gone within usually a couple of weeks, but the worst part is just within a few days. So. And here we'll talk about treatment. So there are some treatment options. And because there's no FDA medication approved for cannabis use disorder or for the cravings or withdrawal yet, we have to rely on therapy aspects to treat this. And one of the most important ones is motivational interviewing and enhancement that's done by a professional. So this does take time and requires a trained professional to provide this sort of treatment. And the goal is essentially to get the person to get to a point where they might be recognizing that this could be a problem for them and it's causing some challenges. It might, impair or impede their ability to reach their future goals. But what it is, it's essentially helping the person move through their own internal stages of change to get to a place where they're willing to think about doing something about it. And then the professional helps them actually make those changes and implements those changes. It comes from a non-judgmental standpoint. And it's really looking at what goals does the person have and trying to help them get to those goals. It's not about abstinence necessarily. If it's just that they need to reduce, then let's just get them to the point of reducing and then look at abstinence in the future. So CBT, cognitive behavior therapy, is also useful, and it can help work through the distorted thoughts, such as someone who might be rationalizing their use or might be minimizing their use. And these are some of the defense mechanisms that we have to keep up, maladaptive patterns of behavior. So CBT can also address emotions and other behaviors that might be reinforcing or contributing to the use of marijuana. And then we've got contingency management, which can be done, again, with a professional guiding the parents and being a part of the process. So what this is having a target behavior, which would typically be not using anything or not using the substance. And we want to frequently monitor that target behavior and offer tangible positive rewards for meeting the goals or meeting that behavior requirement. And then also providing consequences based on not being able to maintain, substance free. So these are all things that can be done. This was a study that we found. We thought it was interesting because it's related to COVID, and it essentially told us that people with a substance use disorder at any time in their life are 1.5 times more likely to contract COVID-19 than those people that don't have a substance use disorder. And those with a recent substance use disorder are more than 8 times more likely to get COVID. Now, it also talked about how patients with substance use disorders are more likely to require hospitalization and to die from COVID-19 than those without substance use disorders. And this could be related to how people with substance use disorders frequently have a lowered lung functioning or diminished lung functioning. So if you think about how if your lungs are already sort of not working at their fullest potential or not the healthiest, then it could make COVID-19 harder to manage because of the way it affects us. So, and then this uh, fourth point there is a quote from a New York Times article, and the article was called Teens in COVID Isolation. And this states that remote learning, lockdowns, and pandemic uncertainty have increased anxiety and depression among adolescents. And related to this is a quote from the Child Mind Institute, which says, when teenagers are struggling with emotional problems, they often turn to alcohol or drug use to help them manage painful or difficult feelings. And if we put those things together, what we think is that we are probably going to see an increase in substance use in youth with this pandemic and the uncertainty and the isolation and the academic struggles that have happened, right? And that's on top of what they already experience in regular life in teenage years. And what you as parents should also know is that anyone who already has a mood disorder, an anxiety disorder, or ADHD is already at increased risk for substance use disorder. So we just want to put this all together and know that we have to do whatever we can to recognize this earlier and to try to get treatment if we need to. So we're going to talk a little bit about legalization and what it's like in New Jersey in just a moment. So the effects of legalization, there are a lot of people that are concerned that there has been an increase in marijuana use, including different versions of this, and a concern for increased ER visits for the toxicity and psychotic reactions. There's also a decrease in public perception, especially with teenagers, about the dangers associated with marijuana. And this is concerning because we know that, you know, some teens already feel like they're sort of invincible, and that's sort of a normal stage of their development. And now we've got advertising that's really specifically targeting youth. If you think about the pictures of the edibles that were there earlier, you know, or the vape pens that might look cool and they're easy to hide and get around. So there is a concern for how we might perceive marijuana now. There's also accidental ingestions by children that have increased. So this is from a study, a research study done at Nationwide Children's Hospital from 2017 to 2020. And what they found was that there's a 2 times increase in accidental ingestions or exposures by children under 6 years old in the states that have legalized marijuana. And over 70% of those accidental ingestions were children under the age of 3, and more than 50% needed hospital-based care. So if you think about how young those brains are and those bodies are and how much they might be getting exposed to with the higher concentration in edibles, that's pretty concerning for children. There's also the concern for teenagers who get pregnant because there's potential impacts on the mother and the infant. And research has shown that pregnant women who use marijuana have about a 2 times more likely risk of having a stillbirth, although there's mixed evidence about whether or not it causes low birth weight or premature birth. But given the potential for marijuana to negatively impact the developing brain, the American College of Obstetricians and Gynecologists recommends that women don't use any marijuana while they're trying to get pregnant, during pregnancy, or while they're breastfeeding. So in terms of legalization, we're going to talk about what it's like in New Jersey based on the newest legislation that's gone through. So, and we're going to go over some of the items related to those who are 21 and up first, and then we'll talk about what it's like for youth. So adults who are 21 and up may legally purchase marijuana up to 1 ounce at a time, and adults can have up to 6 ounces on them without facing any criminal or civil penalties. Now, criminal penalties are supposed to be reduced for those found with larger quantities on them, and retail marijuana sales are supposed to be taxed with a state sales tax. And essentially, the state is saying 70% of that tax revenue is supposed to be given to lower income communities. And New Jersey is going to be giving out licenses to 37 marijuana growers over the first 2 years. So I would assume between 2020 and this year and next year, we'll have, 37 growers potentially. Now we're going to talk about what happens for kids 18 and under. So for a first violation, a written warning is going to be issued by the officer to the underage person. And that warning is going to include the name, the date of birth, their address, and the details of the probable cause or the reason of the warning. And of note is that the parent or legal guardian does not get notified with the first warning. So for a second violation, a written warning is issued to the underage person, and it also goes to the parent or guardian, and they also get a referral to some sort of agency that might be able to provide them like mentoring or substance use services. And then for a third or additional violations, they are going to be fined up to $50, or they can do community service in lieu of that payment. So, and the other pieces are there's going to be restricted searches of juveniles. So essentially, an officer can't request to search a juvenile because in the legal terms, they don't think that a person who is less than 21 has the capability of fully consenting to a search. The law also restricts police from conducting searches of juveniles based solely on the odor that they might be smelling, like the odor of marijuana. If the police smells it, that doesn't mean they can automatically search. And then police cannot search the person or the property just because they see an alcoholic beverage or marijuana or related item in plain sight. So say, someone is in a car and they see a can or a bottle or a blunt sitting on the seat, they can't automatically search the person or the property just because of that sort of thing that they notice. So also a person under 21 is not supposed to be arrested, detained, or taken into custody over this by an officer. And the money that's coming from the civil fines, meaning the $50 fines, are supposed to be to help find substance use or community service programs for people. So I'm going to see if, if Heather might have any, some additional information. If she knows anything else, I'd love for you to chime in, Heather, if you can, about legalization in New Jersey or anything more that you might have run across.
And we can certainly talk about this more in the Q&A, specific questions. I do want to note that with this warnings, written warnings only to juveniles on a first offense, that is currently being taken up in the legislature to try to amend the legislation. Police officers are not happy about not being able to involve parents, and parents are concerned about not being notified if their child has broken the law. So we may see some adjustment to this part of the law. But as far as like code of conduct at the high school, nothing changes there. So if there is suspected marijuana use on school property or at a school event, the same code of conduct will apply, that the child can be, parents will be notified, child can be sent for a drug assessment and that. So.
Okay, thank you. So this slide here is from a study that found that children's risk of marijuana and alcohol use and their attitudes towards marijuana were influenced by the pattern of their parents' marijuana use over time. And if you see the green line with the triangles, you'll see that's the parent who never used. And then the red line is the parent who used after early adolescence. And what you see there is there's an increased risk in late adolescence for either of those sets of parents, right? So their children are at increased risk, even if a parent didn't use. If you see the next line up, which is either dark blue or purple on your screen, these are children whose parents used marijuana primarily during adolescence and early adulthood, and then they lowered their use. And the light blue line at the top is for those parents who used chronically from early adolescence through some portion of their adulthood. And we see that those children were at the highest risk of marijuana use in their lifetime if their parents used for a longer and earlier period. So we want to think about this with our teens and consider saying to them that if they use in their early teenage years, then their kids are going to be at higher risk of using in their lives as well. So. And let's talk about how do we talk to our kids about this. And what we want to do is start with a good relationship for that foundation. Your teen's going to be more open to these conversations if you've started with a good foundation, and sometimes just being with them and playing together, going out together, showing interest in them can help with that. A lot of people and families have family dinners together, and I think that really helps with building relationships. We also want to be a good listener and try to engage or talk to them often. And that means setting aside time from our busy schedules so that we have one-on-one conversations about anything that they're interested in. And in those conversations, we want to respect their opinions, even if you don't agree or think it's right, or if you want to, interject yours, just be able to listen and understand them better in that way. We also want to make sure if we capture them saying something that they've done really well or they're proud of themselves for, or you're proud of them for, then recognize that and take those moments to praise the positive things that you've gotten from them. And we want to set aside time as well to talk about family rules and expectations about this and about other things. So these are not just one-time conversations because they're going to need to hear this again over time, especially as they start to have more independence in the early, the mid to late adolescent years. And we want to, have these conversations in a casual, sort of relaxed way, and try not to lecture about these things. You also want to be sure that you and your partner, your spouse, are on the same page about what these expectations are and what the consequences are going to be, and be consistent about that over time. And if you feel like you need to revisit that, then revisit together as a couple before you have, further conversations with them. And remember that seeing where your teen is at with their thoughts about substances is also something that we got to check in on every now and then, because we know that their attitudes and their opinions are influenced by their friends and their peers, probably a lot more than they're influenced by us at this age. And those things can change over time. So we're going to need to revisit these conversations. The fourth point there is to help your child deal with peer pressure. So we want to ask them, make up a scenario, think about how they're going to deal with it, ask them how they would deal with it, and even think about role playing if they're an early teenager and they're willing to, engage in that with you. You can also ask them if they've already dealt with this situation and how did they talk to the person? How did that person handle it? What could they do differently, sort of? And then the fifth point is to know your teen's friends and their parents. There's a saying out there, right? We've heard it. If you don't know, then you don't know, and that kind of applies here. What you really can't assume that you know how someone else parents their kids. We can't assume that another parent feels and thinks and behaves in the same way that we might, or might have the same sort of standards of their children's behaviors as you might. Um, and not to say that anyone's is better or worse, you just want to make sure you know where it's at and have conversations with your kids about that. So, and the sixth point there is you want to know where they're going, who they're with, and when they're going to be home, and what they're going to be doing. It might seem intrusive to them, especially if you haven't had those conversations before, but it's never too late to start having those conversations. And it's for their safety, and it's really your responsibility as a parent, right? You don't want to get caught off guard by someone calling you at some point saying, "Hey, did you know your teen was down the street at so and so's?" Or did you know that they went to that township? I just saw them walking down the street there. And you don't want to be the parent that has no idea what's going on with their kid, or it's just not going to feel good to you as a parent to find out about this later on. And then there is the point of supervising teens in your own home. Now, you're responsible for the people in your home. And think about this. If someone was actually getting high or drinking in your home and they had an accident while they were in your home, or they passed out, or they were on their way home and they got into an accident on the way home, what would be the consequences for you? Would there be any legal consequences for you? Obviously, the child or the teenager might be hurt, but we'd want to think, twice before we let that happen in our house. And we've heard news stories about, parents being charged for allowing their underage drinking in their homes. And there is the American Addiction Centers has a statement that as of June 2020, all of the states say that only a family member can provide alcohol to a minor on their own private property. And what that means is that really only the parent or a relative can give alcohol to the teen that they're relatives with. Many states have laws that say that social hosts aka parents, in our situation, are responsible for underage drinking events on their property, whether or not the social host actually provides the alcohol. And New Jersey has this sort of a law. Now, this is related to alcohol, but we could extrapolate and wonder if this could be related to marijuana now that marijuana has become legalized. And then the last point there is an app called Talk, They Hear You. And Heather pointed out this app to me, and it is geared a little more towards underage drinking, but I think it can help with practicing those conversations, practicing how to start the conversation and sort of playing out scenarios with your kids. And there are some other points I want to make that aren't on this slide. So one thing to think is that if you've used in the past yourself, this is not the time to try to glorify it or embellish it just to feel closer to your teen. We all want to be that cool parent, but we don't want to be that cool parent in this situation, because it's sort of giving your teen permission that it's okay to use. And given what we know so far, we have to question, is it really okay for them to use? And then if you have concerns, or if you actually have evidence that your teen might be using, or evidence of possible use, then you want to bring it up when everyone is calm. You don't want to do it in any sort of angry manner, or when there's a heated argument about something else going on. You also want to not make an assumption about it. You want to come from a standpoint of understanding and caring what is going on. You don't want to blame or place any judgment on their in their behaviors. You just kind of want to be matter of fact about it. And then we have to remember that our role is to help keep our children um, safe and to help them learn to make good decisions. And that foundational relationship and modeling by parents is really important in their decision making and how they view things over time. So um, the other thing is that I remember someone asking, when's the time to start, talking about this kind of stuff? And I really think that fifth or sixth grade is probably around the right age range to think about talking about this, because you want them to be prepared. You don't want them to be caught off guard in those situations where they don't know what to do, or they freeze, or they might go ahead and try it because everyone else is trying it. You want to know, that you've done your part in helping prepare them for that conversation. So the next few slides here are about treatment and just a couple of other statements. So these are a couple of places where you can start searching for help if you do need help, or your family member needs help. SAMHSA is the Substance Abuse Mental Health Services Administration, and it's got a website there to help find treatment. They also have a helpline that someone can call. Perform Care is actually New Jersey's system of care provider. So it is a phone number that you can call. They have a website as well that you can go to, but they do answer phone calls, and they are able to help connect you with services and different kinds of services if needed. So they can also do an assessment in a short period of time to see what kind of service might be needed as well. So then you can certainly go to your insurance company and through their website to try to find a provider if needed. Now, there are a couple of slides here. One is from the New Jersey Council on Child and Adolescent Psychiatry. And this is the local chapter of the American Academy of Child and Adolescent Psychiatry, which I'm a member of. And part of my efforts today comes to you from the standpoint of me advocating for and educating about children's mental health. So NJCAP sort of put together a policy statement on this, and what they called for increased attention to the public health effects of what happens when we legalize marijuana, and also increased research into the health effects as well as the mental health effects on this. They also want to see more public education to children and families about adverse effects of marijuana on youth, and they want to see more immediate access to evidence-based treatment. So I think these are all things that we can sort of stand behind. And then the NJCAP, as well as New Jersey Psychiatric Association and the National Alliance on Mental Illness, came together with a joint resolution, if you will, or a joint paper, where they talked about these following recommendations, including increased funding of education and research, more evidence-based treatment, and sort of studying the effects of what happens on teens, and making sure that there's enough programs available to children and teenagers who need that. So the main point of these two slides is that it's not just coming it's just not me coming to you as one provider trying to offer education about the risks, but there's many organizations, that are concerned about this and the possibility of increased access and use by our teenagers. So, and that is a list of all the places that we went to put together the topics that we talked about today, and the research and the data that we've had. And then this is my contact information. If anyone is interested in reaching out to me later just to have a conversation or talk, or if you're not comfortable sharing questions here or talking through this here, I'm happy to be available later on for you. So Heather, I think with that, we can get to any questions if there are any.
Thank you. That was a great presentation, lots of information. And certainly one of the things I'd like to add and see, if anyone has questions about the legalization, is that now that it's legalized in New Jersey, we're waiting. The local townships, local towns do have some control over how legalized marijuana can be rolled out in your own municipality. So that's something that MAC is interested in focusing on and knowing, getting community input on, such as, local ordinances can control where retail businesses are located, what types of marketing that the businesses could do in the community. I think, and we're kind of waiting to see once the whole marijuana, the council, the regulatory structure is put in place, like, will they be able to control levels of THC that are able to be sold in retail places within your local borders? So those are things that we're kind of waiting to see and trying to get input from the community on. But does anybody have any questions? If you do, you can unmute yourself and ask the time we have left. We don't expect that legalized sales will start until probably the end of this year, or early next year, by the time that starts. And
Sorry.
yes, go ahead, Wendy.
Question, MAC for years has done a lot of, anti-drinking and driving for the kids. Will you be working on messaging about, driving while high? Because I think
Yes.
the kids think that they can drive while high. Like
Yeah.
they can't drink, but they think they can drive while
Yeah,
high.
that is one of the things, and we've talked about it a lot in the schools, and it's part of the health curriculum. It needs to be a bigger part, but we definitely have seen a perception of risk. It's been drilled into them for so long. They know not to drive drunk. I
Right.
mean, that's well established, but they don't have that same understanding when it comes to smoking marijuana or using marijuana and driving. So that is definitely PSAs that need to get out, education that needs to get out. And a lot of this information too, especially knowing whether, trying to understand, why young people are using it, especially now during the pandemic. There's concerns about using as a means to cope with other issues and those cofactors that are happening, and really being aware of, it may not just be partying per se, but it could be a way to self-medicate during very difficult times. So and kids need to be aware of that so that they feel comfortable speaking up and reaching out for help when they need it, because right now is very difficult for everybody.
What kind of educational efforts like this happen more generally in either the school setting or PTO? It's all very good information, and I don't have a sense that it's really out there in a, sort of a positive way.
Yeah, it's hard, it's hard to reach some, we begin in the schools with, in the elementary schools, it's about making good choices. And then you get to 5th grade and you start with your DARE program. And then going through 6th through 12th grade, it really becomes part of the health curriculum each year. And there's certain things. Now, MMAC works, we have a lot of resources, so we'll offer programs. I know the 12th graders for the last few years have been doing a program called If They Had Known. It was a video produced by a foundation that was started after their son died from an overdose of mixing alcohol and Xanax. So they were using prescription drugs in a party environment, mixing it with alcohol, and he passed away. And the whole point of it was, they weren't aware that there were enhanced effects with that combination. So we've been showing that the last few years in 12th grade, getting things in front of the kids it's just really hard in the high school to find time. Large assemblies don't really have the same effect. They hear it for an hour and then they go, and it doesn't have that same impact. So we're trying to focus and providing information through online that parents can have the resources and kind of continue to bring those conversations home. The peer leaders do a great job of trying to present the messaging when they're in school and doing things like that. There's a high school forum they do in the spring that always tackles a topic such as HIV/AIDS, or they do, I think this year they might be doing opioids and athletes. So there are, we do it when we can fit it in, but it's certainly, we'd like to see more. We'd like to see a lot more, and we do rely heavily on parents to find this information and make sure they're reinforcing it with their kids.
Thanks. It seems high school's like for some of it's a kind of a late start.
Yeah, and that's really honestly the focus, and what they've been talking about in the prevention communities with youth prevention is to start earlier than you think you need to. And you think, oh, these 5th graders, they're so young and we don't really want to expose them to them and give them ideas, but they need those tools early and have at least an awareness, because it happens fast.
Yes. Thank you.
You're welcome. Thank you. Any other questions? Right. Well, I mean, you can always reach out to me, mmacupdates@gmail.com, or through our website. And we will continue to try to put a lot of information out there for everybody as things developed. Thank you, Sonali, Katie. We appreciate all the hard work on this presentation. It was very informative.
Thank you. We appreciate it too. So hopefully we'll be able to do more of these, whether it's on marijuana or something else that our families need to know about. So
Absolutely.
yeah.
So, well, we'll wish everyone a good night.
All right. Thanks. Good night.
Thank you. Thank you.